Every 8 seconds that passes, one person dies from diabetes. For diabetic patients, many mistakes stem from the lack of knowledge of their own disease. Currently around the world, there are nearly 430 million people living with diabetes. It is worth mentioning that 1 out of every 2 people with diabetes does not know they have it. Treatment for diabetes is very costly for the patient and for their family, and can account for up to half of their family's income. With diabetes, there are many mistakes stemming from the lack of knowledge about their own disease, or not being consulted with adequate knowledge about diet, exercise and medicine. Treatment. Here are the mistakes diabetes people make very often. Number 1. Diabetic people think that just controlling blood sugar is enough. According to many studies, despite good blood glucose control, the mortality rate in diabetic patients still does not decrease. Hypoglycemic therapy merely breaks a very small portion of the iceberg, so treatment targeting only glucose is not enough. In patients with type 2 diabetes, the burden of disease is very large. Patients are susceptible to dyslipidemia, cardiovascular complications, diabetic nephropathy, obesity, hypertension, diabetic retinopathy, peripheral neuropathy and other comorbidities. If you have high blood pressure, you have a 4 times the risk of stroke and 3 times your risk of dying from cardiovascular disease. Every 3 minutes a person dies of high blood pressure. Therefore, it is necessary to control all disease factors, but only 18% of patients with type 2 diabetes control all 3 parameters: blood glucose, cholesterol and blood pressure. Number 2. Diabetic patients abstain from carbohydrates and sugars completely. Many diabetic patients think that simply abstaining from all types of sugars and starches which will bring certain effects in blood sugar control. However, that is not entirely true because a diabetic's meal needs a complete and balanced composition of starch, protein, lipid. Number 3. Only measure blood sugar in the morning. Is just measuring blood sugar in the morning enough? According to doctors, it is a fact that blood sugar fluctuates throughout the day. Therefore, it is not enough for a patient to measure blood sugar only 1 to 2 times per month. In particular, the risk of postprandial hyperglycemia is enormous. Postprandial hyperglycemia is related to a series of diseases such as cardiovascular disease, retinopathy, decreased myocardial perfusion, increased mortality, impaired cognitive function, increased cancer risk. The goal of blood sugar after eating 1 to 2 hours is below 10 mmol/L. Diabetes specialists said that type 2 diabetes patients are mostly elderly people. Besides diabetes, they have other diseases such as hypertension, heart disease, cholesterol metabolism disorder. But the patient only controls blood sugar. But forgetting about 2 factors of hypertension and dyslipidemia is also a risk factor for interaction, affecting the patient's complications. Number 4. Use a prescription. Forever. Humans will gradually age, get older and weaker. Like with type 2 diabetes, insulin secretion decreases over the years and is a chronic, progressive disease. Many patients have a prescription for insulin injection, but in reality very few agree to inject. The main reason is that the patient does not understand the benefits of early insulin therapy and thinks that the disease will get worse, when in fact insulin therapy is a natural course, not a more severe illness. In addition, many people with diabetes have been treated with prescriptions of acquaintances or told by relatives. However, in reality, each patient will have a separate treatment goal. The response to the drug is also based on the pathology and other combination diseases such as liver failure, kidney failure, coronary failure. Therefore, it is impossible to use one person's prescription for the other. The general use of such prescriptions sometimes leaves the patient with undesirable effects such as excessive increase or decrease in blood sugar, even liver failure, kidney failure. Number 5. Out of medicine but do not buy and continue to use but wait until the date of re-examination. This is a very dangerous mistake. Type 2 diabetes patients with insulin deficiency will cause high blood sugar, fatigue, and increased risk of infection. In a 6-hour insulin-deficient type 1 diabetic patient may need to go to the emergency room for ketoacidosis. If diabetic patients do not use drugs, it can lead to erroneous results in blood glucose, difficult to adjust the dose. Number 6. diabetic patients do not know how to emergency hypoglycemia. Hypoglycemia is blood sugar below 4 mmol. According to doctors, hypoglycemia is more dangerous than hyperglycemia. Hypoglycemia more than 6 hours can lead to brain death. The consequences of hypoglycemia include coma, increased hospitalization costs, dementia, loss of consciousness, convulsions, decreased quality of life. For the emergency treatment of hypoglycemia, the doctor says, test your blood sugar to make sure it is low. If the patient is awake, drink sugar water, soft drink, eat rice. In the case of a comatose patient, need to be hospitalized for an urgent glucose infusion. Number 7. When sick, always quit antidiabetic drugs. There are many patients who think that if they get sick, if they eat poorly, their blood sugar will drop, so they need to reduce or stop taking diabetes medicine. However, in fact, when sick, the hormones in the body will increase, causing blood sugar to rise. So what to do if the body is not well? Doctors recommend, people need to measure blood sugar every 3 to 4 hours, sometimes every 1 to 2 hours, record blood sugar test results. When you have a fever, you eat less, but your body needs more insulin, so you need to keep the same insulin dose. Continue to monitor your blood sugar and condition at midnight, even when very tired. Increase water intake to prevent dehydration. Eat the right meal even though it is very tiring. If vomiting a lot, drink sugary water. Use essential medicines such as antipyretic, antibiotic. Number 8. Treat yourself to foot ulcers at home. Foot complications have expensive treatment, long hospital stay. When diabetic patients have foot ulcers, the risk of amputation is very high, even up to the thighs. Many people think that it is possible to treat foot ulcers on their own at home, thinking that a tiny sore is nothing to worry about and that it will heal on its own. However, in reality, if there are already foot ulcers, although very small, it means that the patient has had many serious complications such as complications of nerves, blood vessels. Therefore, it is necessary to go to the hospital as soon as there is an ulcer. Patients must always remember that blood sugar control must be parallel to blood fat control. Hypertension, cardiovascular is extremely important. We must exercise regularly, adhere to the diet, and have regular blood sugar checks to know what level we are at, so that we can have good blood sugar control and the risk of complications.